All right, Steve, now to the innocent victims of America's opioid crisis, babies and children who can't help themselves, now caught in the middle of this cycle of addiction. Babies and children who suffer because of their parents' addiction.
Our Kimberly Gill joins us now live from our local 4 phone bank. And Kim, this problem is becoming more and more widespread.
Yeah, it really is, Karen and Devin. We'll talk more about that in just a moment. But first, I want to let you know I'm in the local 4 phone bank with experts from Families Against Narcotics, Brighton Center for Recovery, Detroit Wayne Mental Health Authority, and Oakland Community Health Network. They are taking your questions until 6:30 tonight, and then again during our special report, which will air at 10 p.m. You can call the number on your screen. That number is 844-934-8435 or 844-WDIV HELP. Now, as you were saying, Karen, a big concern with this opioid crisis is how children are affected when their parents are suffering from this addiction.
It's very emotional, and I cry a lot up here.
Pat Jordan cares for babies who are suffering.
We just let them know it's going to be okay.
She volunteers inside a neonatal intensive care unit at an Orlando hospital. The babies are born with neonatal abstinence syndrome caused by opioid addiction.
The mom's system absorbs the opioids and then it gets into the babies, and the babies then have to go through what's very similar to a withdrawal.
It's a very real problem in Michigan. The Department of Health and Human Services says in 2014, 286 babies in Metro Detroit were born with neonatal abstinence syndrome. The cases are easy to track because hospitals must report any suspicion of substance abuse.
We're definitely seeing an increase in the number of children that are placed into foster care due to opioid addiction and dependency by their parents.
The state agrees there is an increase and is launching a plan in October to track the actual number of opioid cases Child Protective Services is seeing. Right now, there is no system in place to do that.
One of the things that I'm hopeful about there is that as we get better data and we use data to help inform better decisions, I think we'll be more effective in serving the families.
Colin Parks manages Child Protective Services, the agency that investigates suspected cases of opioid abuse involving children. He encourages people to report any situations where they believe children are in danger.
One of the things that we always try to do as a department is recognize that the best place for a child is with their parent whenever it's safe to do that. And so the hope would be that, you know, the cases that really were high risk, intensive risk, will get the services they need, and that may be out-of-home placement, it may not be.
Maria Lesnaw runs Guiding Harbor in Belleville. She's seen the worst case scenarios where parents can no longer care for their children because of this addiction.
Can you try to help me to understand what these kids are faced with and what they've gone through?
So oftentimes these children have been, you know, the caretaker of the family. They're trying to, you know, care for themselves or their siblings and really take charge of a household at times. We've had children that have been abused, neglected, sexual abuse, and they're not really able to express themselves when they first come in because, you know, you're taught in families that you need to protect your family, and so a lot of times children don't tell the truth right away.
Yeah, and Park says less than 5% of all cases they see, including those involving opioids, never get to the court system, and even less end up with children being taken from the home. Lesnaw says more foster parents are needed, and they try to keep these children with relatives when possible, but it's not always the case. Also, head to clickondetroit.com where we have a special Opioid Nation resource page about this epidemic. You can see all of our reports there. People are also sharing their stories of addiction and so much more. But it is just heartbreaking seeing those little babies, you know, there's just
needing to be held while they go through this awful withdrawal.
Yep, yeah, exactly.
Yeah.
Thank you, Ken.